Hi everyone, I'm Forbes Riley. Let me ask you a question. When you wake up in the morning, do you hurt? I mean, if you're like me, maybe you've been in a car accident, a ski accident, or in my case, I tore my ankle just stepping off a curb. Odds are that at a certain age, life has taken its toll on your body. You suffer from pain in your knees, your shoulders, your neck, and the worst part, when you're in pain, it's hard to get a good night's sleep. Well, what if I told you there was a solution? One that requires no surgery and no downtime. With this type of cutting-edge regenerative medicine, imagine that you can once again live life to the fullest and enjoy all those things you thought were not possible, like playing with your children, your grandchildren, taking a walk on the beach, playing around a golf, or even just enjoying a good night's sleep. In a moment, you'll discover how this revolutionary breakthrough in medicine is now available to all of us, helping to diminish pain in your ankle, your knee, your hips, shoulders, and even back pain. But it also helps with neuropathy and pain associated with arthritis. In a moment, you'll discover that you can once again enjoy the activities in your daily life. And in just a moment, you'll discover the secret to turning back the hands of time. See, the good news? You no longer have to live with pain, thanks to the Stem Cell Institute of America. And on our show, you're going to hear from top researchers, doctors, and patients who call this therapy nothing short of a miracle. So let's get started by meeting my first guest. My name is Dr. Jill Howe, and so excited to have you on the show.
Thank you.
Tell me about your mission.
Well, I'm on a mission to help people across the country understand the incredible capabilities that stem cells have.
So what is a stem cell?
Well, a stem cell is a cell that everything in your body stemmed from. It's what made you. It's what made your eyes, what made your hair, what made your knees, what made your fingers. It's everything in your body came from a stem cell.
Okay, and we have them in us at all times?
We have them in us at all times, but the highest potential for growing is when you're a baby. And so there are different places that you can get stem cells, but the place that we get them is from moms who consented and passed rigorous testing to donate their placenta after their baby is born via C-section.
I gave birth to my twins, and that placenta we threw away.
Right, and that's what most people do, they throw away.
And those cells, not rejected by people, anybody can get those cells.
Before it's born, it doesn't have an immune system, so these cells can be given to anybody without any chance of rejection.
Okay, so when you're a baby, or when you're young, you've got a lot of stem cells.
You do, you have 1 in 10,000 cells in your body as a stem cell. Now by the time you're a teenager, 10-fold drop to 1 in 100,000 cells. By the time you're 60, it's 1 in 1,000,000 cells. By the time you're 80, 1 in 2,000,000 cells. So your ability to heal goes down dramatically as you age.
Well, so up till now, if you're like, I have no cartilage really in my knee, at some point when bone on bone, you're looking at a knee replacement, correct?
And people think that bone on bone means there's zero cartilage left. Well, there's some little fibers that are there that are sending out an SOS signal. And when this product is administered, there are proteins in the product that actually pick up that SOS signal and drive the cells to that area. So the body's saying, I need more cartilage. That's what the cells produce.
You can just introduce this product into your body and it starts to regrow things that are missing.
So it's not that you have pain, it's the reason why you have pain.
Right.
The cartilage is gone, the bone is degenerated, you're developing arthritis from that abnormal wear and tear now.
Wait a second. I've read things that say there's nothing you can do for arthritis.
So pills will take away some of the inflammation or help you with the pain, but again, that degeneration, it continues to occur until all that you're left with is the ability to get surgery, up until now. So this particular type of therapy, when it's injected into the area that's injured, will go in and regenerate that tissue that you're missing. So you can get new cartilage, you can get new knees, you can get new shoulders, new nerves.
Do you know how many people this will help?
I do, and that's why I'm on a mission, is to get the word out there, because I think that's why so many people aren't aware of what it is, including maybe some doctors, because there's not enough information.
So one of the things that you do, the mission that you're on, is you tour around the country, as well as a whole group of doctors, and they're called the Stem Cell Institute of America.
Yes.
What is that?
Well, there are 150 of us. We're an army, and we're going out there and delivering seminars, multiple seminars every single day across the country to educate people. It's completely free. We invite you to come to a free seminar, and we'll educate you about what your options are, including stem cell therapy and other advanced options.
So I just have to ask you, if you've got pain anywhere, if you're suffering in your joints, your ankles, your knees, your hips, your neck, your lower back, and now if you've got arthritis or neuropathy, there's so many treatment options.
That's
to
right.
Just go get educated to find out what your options are.
Right, you have nothing to lose. Here's one guarantee I can make, because you can't make guarantees in medicine, but one guarantee I can make is if you don't do anything about your health problem, it will get worse.
So is this therapy right for everybody?
It's not right for everybody. I would love it to be the answer for everything, but it's not right for everybody. But I'll tell you what, the people that it's right for, oh my gosh, like Jerry, who had 30 years of back pain, couldn't even dry off after he got out of the shower, had tried everything from doctors to shots to surgery. Now he's feeling great. He's walking around, he's gonna start playing golf again, and he got his life back.
Just from a treatment?
Just from one treatment. It's incredible.
So I know what pain does to people firsthand. It makes you miserable, it shuts you down, you don't want to do anything, and sometimes you don't even know if you want to keep going.
I've had many patients tell us that. They said, you know what, if this doesn't work, I really don't know what I'm going to do. I've looked at other options, like I don't want to be here anymore. And that breaks my heart to think that as a community in medicine that we failed this patient.
Right.
And to give them hope, and not only hope, but to give them results is, they just want to go out and shout it from the rooftops and tell everybody that they know about it because they don't want anyone else to suffer like they've been suffering. I think it's an incredible technology that has many applications across the world. Stem cell therapy treatment is being used to help people with type 1 diabetes regrow the part of their pancreas that doesn't work, that causes them to rely on medication to live a healthy life or to live their best life.
Do you guys take insurance?
Well, we take insurance in our clinic. Now, this particular type of care, what I ask people is, you know, you're in pain. Like you said, you're in pain. You're losing sleep. You can't do the things that you like. We had a gentleman that said, I just want to be able to rock my grandbaby, and I can't because my knees are so bad. Or I just want to spend time with my wife, or I want to travel with my kids. And I ask him, how much is that worth to you to be able to do that? I mean, ultimately, we're responsible for our health.
I agree.
Not insurance, not our spouse, not our work. It's us. We're the only one in this body who knows what it feels like. There have been over 300,000 treatments done with this particular product with not one reaction.
Okay, have I taken away all of your doubts right now? You don't even need to listen any longer. The number that you need to call is on your screen.
Are you one of the millions of Americans who suffer with pain? From osteoarthritis of the knees, neck and back pain, shoulder pain, or even neuropathy? There is now a solution that does not require surgery or downtime. Stem cell therapy is cutting-edge, regenerative medicine that could allow you to once again live life to the fullest and enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf. And now, the Stem Cell Institute of America is coming to Chicagoland with over 15 seminars to choose from all over Chicago and the suburbs. If you are suffering with pain, these are must-attend educational stem cell therapy seminars. You will find solutions that could really help change the way you live. For more information, visit stemcelltherapyforpain.com or call the number on your screen now.
Right now we're joined by regenerative medicine researcher from the University of Florida. Please welcome Dr. Mark Moore, PhD. Now, what has the research told you about regenerating the joints in the knees, the hips, and the shoulders?
The studies have shown that they have the capability to regenerate tissue, reduce pain and inflammation within the joints of hips and of elbows, etc.
Is this FDA regulated?
Well, the FDA does manage the process, and there are a lot of guidelines that have to be enforced and adhered to. They're from healthy births, and this tissue is normally waste tissue. It's normally thrown away, but the mothers donate the tissue in order to help society and as a potential to make someone else's life better. And so these tissues are from cesarean section births, and they're all clean and sterile and healthy tissues.
So how much testing is done to make sure that it's safe?
They've had decades-old research to show that they're safe, effective for healing all sorts of tissues, and so now they've been used in ocular uses. They've been shown to stimulate nerve cell growth, so they have a lot more potential that hasn't been tapped yet.
Well, Mark, I want to thank you so much for sharing your time today. I'm sure that you're very busy at the University of Florida doing the research, but is there anything else before I let you go that you would like to share with us?
So I know the story of one truck driver who had osteomyelitis of his toe. Basically, his bone was, his joint was severely degraded, and he had an infection, and so it was about to lead to amputation of his toe. So he had an injection of a flowable amniotic membrane, which saved his toe.
Well, we continue to hear story after story of what patients are calling a miracle therapy, truly being able to live without pain. Take a listen to this one.
I thought I was going to have the pain for the rest of my life, Till I got those stem cell injections 2 months ago, the stem cells really did the job.
Well, now I'd like to introduce you to a podiatrist who uses amniotic tissue in the healing process in his practice. Please welcome Dr. Lou Chiliberti.
Hello.
Lou, how are you?
Good, nice to meet you.
So you started introducing it to your practice, and what have you seen?
I've seen amazing results. I've seen all of that. Decreased inflammation, improved healing, faster healing.
So explain to me, what is your practice like?
So my practice is a foot and ankle practice that encompasses pretty much everything foot and ankle that you could think of. It's a high surgical practice. So I do a lot of trauma, I do a lot of sports medicine, and then I do a lot of elective surgery as well.
Now, tell me a great patient story. Do you have one?
A woman that had come to me who had had leg pain for years, neuropathic type pain. So this was more of a nerve type of an issue. She was complaining of numbness and tingling in her leg. I used the amniotic tissue, and this woman went on to have a remarkable recovery, something that she was dealing with for years.
I mean, have you seen cartilage grow back in areas?
So I've used this amniotic tissue to help regenerate bone, to help regenerate soft tissue.
But people who've been suffering with pain for a long time, have you seen it work for them too?
One of those patients that comes in that says, hey doc, I've had this chronic pain for years. I've tried everything. I've tried physical therapy, I've tried surgery, I've tried corticosteroid injections, I've tried you name it. This is an alternative that you can offer to those folks.
When I started having the pain level went up to 8. And after the treatment, my pain level is less than 1.
Are you one of the millions of Americans who suffer with pain? From osteoarthritis of the knees, neck and back pain, shoulder pain, or even neuropathy? There is now a solution that does not require surgery or downtime. Stem cell therapy is cutting-edge, regenerative medicine that could allow you to once again live life to the fullest and enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf. And now, the Stem Cell Institute of America is coming to Chicagoland with over 15 seminars to choose from all over Chicago and the suburbs. If you are suffering with pain, these are must-attend educational stem cell therapy seminars. You will find solutions that could really help change the way you live. For more information, visit stemcelltherapyforpain.com or call the number on your screen now.
And it's my responsibility as somebody who's on television to bring and do the best research I can for everybody listening.
Right.
So I met Jerry, your patient, and I'm going to tell you, let's take a listen to his testimonial. He's right there.
We went ahead with the stem cell treatment on my back, and right now I would say the pain is not there. When it first started, it was, I would say, a good 9, 10. And now I just don't have that pain at all. It's gone.
It makes you feel very sad to watch someone hurt the way he was. He couldn't sleep nights. He was just in pain all the time. He's much happier, which makes me happier.
He sat here and he said it not only his life better, but his wife and his marriage and his kids and his grandkids. You know, he said that his pain was like a 9.5, 10, and now it's like a 1.
I can't even imagine living with pain. 30 years he lived with this pain, and he's really an ambassador. Out where he lives, we do these workshops out there frequently, and he's starting to become a celebrity out there. Oh, I know Jerry. I talked to him. I saw his wife, and they go out and they talk to everybody they know about this. They don't want anyone else to suffer like Jerry did.
I think it's one of the most miraculous things that I have ever been a part of.
It warms my heart when I hear people's after stories. In fact, some of the people that come in, I say, isn't it great to be an after and be the person that's out living their life? At the workshop, I always ask, what are you going to do when you don't have this pain anymore? And the things people talk about is everything from, I just want to walk around and do what I normally do, to I want to go back to work, and then this 83-year-old gentleman who wants to go skiing. You see them light up and come alive again when they're really thinking about, oh my gosh, if I didn't have this problem, this is what I do. And that's what we want to make their dreams come true.
Now, we do have to be very, very clear that it is not for everybody. And as much as I would like to say it's a perfect answer to everything, it can't be. There are people that it may not be right for.
That's right. And once you come to the seminar, when you decide to come in for the consultation, we will sit knee to knee with you just like this,
right,
and find out from you personally what's been going on. How did you get in this shape? What have you tried so far? What worked and what didn't work? And then we'll do an exam. And that's where we really help you, the person, understand. It's really easy to say my knees are bone on bone, but when you see an x-ray, I've had people come to tears because they say, oh my gosh, that's what I'm walking around on. Or show their husband, see honey, I told you something was wrong with my neck. Look at it.
Right.
And once they see it, there's nothing that can stop them from getting the care they understand that they need. And it makes my day when that connection happens and I know it's over. They don't have to deal with this anymore.
All right, so we're almost coming to the end of the interview. Is there anything you'd like to add?
If you come in and we can't help you, we'll tell you. But there's nothing in your life that's more important than your health. I've had people say, like you said, I would give anything to get my health back. And it's even more heartwarming when you see a spouse say, I've done everything. I've been on this journey with my wife and no one's been able to help her. And then see her get the help and see, it makes me tingly just talking about it and see them really enjoy their time together. You know, they work so hard to retire. We all do. And you don't work that hard to spend the rest of your life in a wheelchair or confined to your home or in pain all the time. And to really see people's lives literally change is the reason that I do this every day when I go out and educate people. And I'm not going to stop because it's the thing I'm most passionate about.
Well, now, not only have you done it for other people, but you've done it for you and your husband, haven't you?
Yes, I have. And for me, it was a miraculous story because 14 years earlier than I did my treatment, I had a dance accident at my sister's wedding. And long story short, for 14 years, I doctored myself. And I thought, I can just push through this. And it got so bad that I couldn't even walk. And I went to the doctor and they said, you need an ankle replacement.
Oh, really?
And I thought, I don't even know what that is. And then they told me, well, this other option is we could use stem cells. Because my ankle was literally, in an x-ray, there was no joint. And so they did the stem cell treatment and I have a joint again and I can walk around and I can do whatever I want again. And I didn't think for a while that was going to be possible. I have a 7-year-old son. I thought, how am I going to care for my son, let alone do things with him? And so when I saw the miracle that happened in me, I thought, we got to bring this into our practice. And ever since we learned about it, we haven't stopped educating people.
Wow.
And
your
my
husband?
Oh
yeah,
my gosh.
go ahead.
My husband has neuropathy in his feet. And it was
and for those of us who may not know what that is.
Neuropathy is when the nerves in an area are dying. And
it's very debilitating, isn't it?
It is. And they're hopeless. There's nothing really that can be done to make a significant change. Maybe you can change the pain, but just like degeneration, neuropathy is an ongoing degenerative problem that doesn't stop. And so the nerves were dying and he was in pain all the time. We have 2 big Great Danes and we have a 7-year-old son, like I mentioned, and he would keep them at distance, which is heartbreaking to see for our son. And he got the treatment and we went to a concert that weekend and he kept bouncing up and down. And I said, what are you doing? And he said, I feel like I'm walking on pillows. My feet don't hurt anymore. And it was just incredible because I didn't know what to do to help him before. And this really was the most amazing transformation I've ever seen.
Imagine being out of pain, running, jumping, walking on the beach, and not thinking about how much you hurt. I personally know how debilitating that can be. So you owe it to yourself to call the number on your screen or the website that you see right there and take action. Don't wait.
Are you one of the millions of Americans who suffer with pain? From osteoarthritis of the knees, neck and back pain, shoulder pain, or even neuropathy? There is now a solution that does not require surgery or downtime. Stem cell therapy is cutting-edge, regenerative medicine that could allow you to once again live life to the fullest and enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf. And now, the Stem Cell Institute of America is coming to Chicagoland with over 15 seminars to choose from all over Chicago and the suburbs. If you are suffering with pain, these are must-attend educational stem cell therapy seminars. You will find solutions that could really help change the way you live. For more information, visit stemcelltherapyforpain.com or call the number on your screen now.
So it's my great pleasure to introduce you to the editor and publisher of Pro Football Weekly. Please meet Mr. Hub Arkish. How are you?
I'm good. How are you?
Now, you have a very interesting story to tell. You were in pain for a lot of years, weren't you?
I was, yes. A lot of years from a lot of places. I had surgeries on both my knees. I've had back surgery. I've had elbow surgery. I've had a lot of surgery.
Wow. And
the knees in particular, though, I had been to several doctors who'd recommended complete knee replacements, and I said, no, I'm not going to do that. But I also reached the point where I couldn't go much further. And I heard about Dr. Howe and her treatment, and I had stem cell injections in both knees. It's a little over a year ago now. The left knee is 100% pain-free. It's just tremendous success.
Okay, should I do this? Should I not do this? What would you recommend?
Well, I've had great results, so I would say do it.
So do you feel it's a real improvement in your quality of life?
I mean, the last couple of years, it had gotten to the point where the right knee was pretty much on fire all night long. I mean, it's really completely taken care of my biggest concern, which was just the ability to do normal things like get a night's sleep.
Well, so give me on a scale of 1 to 10. So at its worst in the middle of the night, was it a 10?
I always say 9.5 because I assume there must be something worse than what I'm doing. But yeah, it was right there.
And so now at 9.5, that's pretty bad. And now?
At night, 0. I was taking anything I could get my hands on for a while.
Right.
I wasn't an addict, but I mean, all the prescribed painkillers, all the non-prescribed painkillers. I haven't taken a painkiller at all since I had the shots.
So, Hub, I want to thank you very much for being my guest. Well, now we're going to hear from somebody very special. He's a top 20 finisher in the Chicago Marathon who thought, thanks to pain, he would never be able to run again. Let's take a listen.
Pain does funny things to you. And getting away from pain just opens the door to let your life go again. It's got me jacked up. I'm ready to start training again to the level I was. Being an old man, you learn things. I'm going to be a wiser runner now, and I'm going to have the hip that I had when I was young.
Well, right now, I'd like to introduce you to a very special guest who's joining us from Denver, Colorado. Now, he works with professional athletes, some of who you know, but I'm not going to say. Please welcome Chris Nisler. How are you?
I'm doing great, thanks.
Tell me, what is it exactly that you do?
Well, I'm a performance-based rehabilitation coach. So I work with athletes, active individuals, but primarily my main focus is elite and professional athletes.
Have you been using stem cell therapy in your practice?
I have. I've been using it for the past 6 years.
Okay, so explain to me, how do you actually use it, and what have you seen?
And I mean, NFL, it's like going through a major car accident every week.
Right.
So by incorporating the amniotic tissue into our therapy, we're able to keep them feeling better and moving pain-free and preventing injury in order to get through that marathon NFL season.
So what part of the body do you find it works most effectively in?
Man, I really haven't had too many experiences where I haven't seen success with it.
Well, and I venture to say that you came all the way here to talk to us today because it's important. I think this is a medical breakthrough.
Yeah, I would definitely agree, and it's, I've spent the past 6 years of my life kind of waving this banner and showing people what it does. I've seen such great results with it. It's something I'm very passionate about. The thing that gets me out of bed every morning is having my players call me, text me, and say, "You wouldn't believe how good I feel. I'm out moving around, like I was able to throw today and didn't have any pain." That's the reason I got into this.
Chris, I want to thank you so very much for your time, for your passion, and I think you get to decide for yourself. If it's good enough for professional football players who ram into each other in the NFL, Mom, Dad, Grandma, I think it's good enough for us to try out.
After treatments at the Stem Cell Institute of America, my pain level went from a 10 down to perhaps a 2 or even a 1. The major thing, however, is at the start, when I could only walk, let's say, 3 blocks and get to a pain level of 10, now I can walk probably 3 miles before I get to any significant pain level.
So we've heard how stem cell therapy can positively impact your knees, your back, your neck. But imagine it can also work in your mouth? All right, well, joining me now is dentist and implant surgeon, Dr. Oleg. I'm so excited to have you come to the show.
It's a pleasure.
All right, so, by the way, you're not only just a doctor, you're also a patient.
Yes, I am.
So you've had the stem cell therapy where?
In my knees.
Okay, what was going on in your knees?
Several years ago, I was starting having difficulty walking upstairs or taking big steps, walking up ladders. Not that that's part of my job, but just regular things that would make your life difficult.
On a scale of 1 to 10, how severe was the pain getting?
I was getting up to an 8.
Oh, wow.
I'd have to say.
What kind of activities did your knee pain keep you from?
Walking a lot, hiking, household chores, even getting in and out of the car was difficult sometimes, stepping up into it, and it just took a lot more effort.
And your results?
My results were phenomenal, actually. My knees are back to where they were 10 years ago. I have no pain whatsoever right now in them, as if nothing has ever happened.
All right, so you're telling me that because of stem cell therapy, your pain went from a 7 to a 0?
8 to a 0.
8 to a 0, that's even better.
Yeah, it's remarkable.
How long has it been since you had the procedure?
A little over a year.
Yeah, and did you notice that it gradually got better and better, or was it all at once?
It took several weeks to a month before I started noticing a lot of improvement, but then it just got better and better to the point where 8 months in, I had no more pain whatsoever doing any activities.
So now, as a patient, this worked wonderfully.
Thanks to the Stem Cell Institute of America, my life has improved drastically from being able to live a pain-free life and do the things that I once enjoyed doing and continue doing them.
Yeah.
Well, now that my knee doesn't hurt, I look forward to life, waking up every morning and doing the things that I used to love to do.
So somebody out there is listening to this conversation right now. What do you think they should do for real?
If they are having pain in their joints, and they haven't been able to relieve them with conventional methods, they should certainly inquire from the Stem Cell Institute of America about getting a consultation or information about this kind of therapy.
So now it's up to you. If you made a decision that you no longer want to live with pain, whether it's in your ankles, your knees, your hips, your lower back, you know what you need to do. You need to check out all the resources available to us, care of the Stem Cell Institute of America.
Are you one of the millions of Americans who suffer with pain? From osteoarthritis of the knees, neck and back pain, shoulder pain, or even neuropathy? There is now a solution that does not require surgery or downtime. Stem cell therapy is cutting-edge, regenerative medicine that could allow you to once again live life to the fullest and enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf. And now, the Stem Cell Institute of America is coming to Chicagoland with over 15 seminars to choose from all over Chicago and the suburbs. If you are suffering with pain, these are must-attend educational stem cell therapy seminars. You will find solutions that could really help change the way you live. For more information, visit stemcelltherapyforpain.com or call the number on your screen now.
Well, I did it. I listened to what everyone said and said, you know what, I have to jump in. I went to Jill's lecture, I heard all about stem cells, I did my own research, and I did it. And so here with me now, and this is very exciting to share, is the physician's assistant who did the procedure. Please welcome Stephanie Godey. Hi.
Nice to see you.
How are you? Okay, so you gave me an exam. I mean, I'm going to give you guys, literally, this is my own personal testimony, and I don't normally do that in a show, but I got so excited listening to everybody, literally going from 9 and 10 pain to nothing. So many people have gotten so many amazing results. Do you have an example you can share with us?
Yeah, so we have a patient, Linda. So she actually had her left hip and her left thumb done, and she responded actually within days. So she's one of our lucky ones who actually gets the instant anti-inflammatory effect. And her pain started off around like an 8 or a 9, and now it's pretty much not there.
See, this gives so many people so much hope. We are living longer, but it's only fun if we're living better.
Yes.
Because when you're in their office in particular, they're over the moon. They just get, if it works, you get to do it. Right. But you have to make that decision for yourself. You need to be responsible here. So get educated, learn about it. But I got to tell you, if you're in pain and you're suffering, like me, you might not have any other place to turn. This could very well be the answer that you're looking for. Stephanie, I want to thank you so very much. I'll see you, and I'll call up and tell you how I'm doing. Right. Imagine being out of pain, running, jumping, walking on the beach, and not thinking about how much you hurt. I personally know how debilitating that can be. So you owe it to yourself to call the number on your screen or the website that you see right there and take action. Don't wait.